in South Africa at the moment. But we have decided that we're going to focus on 3 issues that we regard quite critical at the moment. But during question and answer time, please feel free to ask anything you may wish, because, as I said, I think there are a lot of things going on out there at the moment that you may seek some clarity on, or you perhaps want our perspective or views on. The 3 areas I'm going to touch on this morning are the Health Professions Council of South Africa, the National Health Insurance Scheme and the current rollout, and then what we have termed what are the true cost drivers of healthcare in the private sector in South Africa. So to kick off on the HPCSA, the reason we actually want to address this particular matter is given the fact that about a month ago, the Health Professions Council, you may recall, released a press statement, in fact, had a press conference where they made a couple of assertions. And it was founded on the fact that they believe there's a decline in professionalism in the medical profession in South Africa. And we noted that with extreme concern. The reasons they gave for the decline in professionalism was really based on 2 or 3 issues. The one was the number of complaints that in fact is coming through to the Health Professions Council over the last 4 or 5 years. And they say there's a year-on-year increase. And the second issue is that they say that medical insurance groups such as the Medical Protection Society, or MPS, have been noting a rise in the amount of money they are in fact paying out to people claiming medical negligence. Now, when one actually analyzes the data of the number of complaints that in fact is coming to the Health Professions Council, we're not entirely sure the assertion that there's a decline in professionalism in fact is true, because they say there's a year-on-year increase, although if you look at the hardcore data, there's about 2,500 on average complaints per year they're in fact processing. And yes, there was a transient increase in 2010, 2011 to about 2,900, but for the 2011-2012 cycle, that's down to about 2,400 again. So I'm not quite sure where this assertion comes from that there's an increase. When you look at the kind of complaints in fact coming through to the council, a large number of them, for example, center around people complaining about billing and overcharging and issues such as that. And it's our assertion that the core reason this in fact is happening out there is because of the vacuum that is being created in terms of tariffs and fees by the Competitions Commission ruling of about 8 or 9 years ago. And just to expand upon that, the Competitions Commission rule essentially that we as a profession and as a healthcare industry may not set tariffs. And we in particular were targeted and in fact had a judgment against us, and we're not allowed to be setting tariffs. And we traditionally were actually involved in that area, in fact creating ethical tariffs, and tariffs as guidelines, not tariffs for charging, but tariffs for what would be an ethical guideline for what a practitioner may be charging out there in the private sector. So if somebody complained to the Health Professions Council about overcharging, there was actually a guideline tariff that existed as to which you could benchmark that assertion against. That doesn't exist, and that's created a huge vacuum. And we're on record as saying that that ruling by the Competitions Commission is wrong, it must be reversed, and if that issue is effectively dealt with, you will see the number of complaints around overcharging coming through probably drop quite dramatically. The other issue on the number of complaints coming through was this complaint that there was an increase in inappropriate relationships between doctors and their patients. And whilst that may be true, the number in fact is not stark, and we're again on record as saying that any such relationship or any such claim is clearly unacceptable, is unethical, and we would never stand for it as well. The overall number of doctors that in fact have been struck off the roll, that is the most heinous of ethical misdemeanors, would in fact get you off the roll, is roughly about 4 per year. Okay, so over the last 4 or 5 years, we've had about 16 people struck with the role. This is in relation to over 29,000 people registered with the Health Professions Council as doctors. So I think that represents, if my maths is correct, less than 0.001% of all doctors, and I think that's an extremely small amount. So I'm not quite certain, or we certainly cannot see how this represents a decline in professionalism within the country. The issue around the rise in claims against, as noted by the Medical Protection Society, I've had personal interaction and discussions with the head of the MPS based in London, and they've assured me that this is not unique to South Africa. It's the trend that they are seeing in other countries such as Australia, New Zealand, and we well know the US is a prime example of where claims are increasing. So this is not unique to South Africa. It's the nature of the worldwide trend, unfortunately. But an issue that also does concern us is that the Health Professions Council, in their statement, has encouraged the public to complain. And I need to be very clear. From SAMA's side, we have no issue with those who feel aggrieved in terms of the way they've been dealt with by a practitioner having the right of access to complain. We're not entirely sure this is the mandate of the Health Professions Council. The Health Professions Council's mandate is quite clear. It's protecting the public and guiding the profession. It is not there to tout for people to lay complaints. I think many of you will know, and in fact, probably from some of the media outlets you come from, there are many adverts I hear on the radio of law firms touting for business. And I think we need to be honest about that, because it's business for those law firms, and many of them do it on contingency. They tout for business and say they encourage people to complain, so-called ambulance chasers. So I'm not entirely certain, and we are definitely of the assertion, as SAMA, that it is not the role of the HPCSA to be touting for patients or the public to lay complaints against doctors. What we would rather say is the role of the HPCSA is to guide the profession. And the question I have to ask is, what have they done to increase professionalism amongst the profession? And I think, all due respect, you would find that somewhat wanting. On the national health insurance, from SAMA's perspective, our policy is one that we have reascertained every, 2 years in fact, at our National Council, which is our body of representative doctors from around the country that meets once a year, as a policy that we support the principle of universal access to healthcare. Now, clearly, the model on the table by government to achieve universal access to healthcare is the National Health Insurance Scheme. As you would know, the Health Minister, Dr. Motsoaledi, launched his pilot projects on the 1st of April. I don't think that was intentional. It wasn't a joke to which not April Fool's Day. But it was launched on the 1st of April, and 10 districts around the country, in fact, are currently underway. As SAMA, we are engaging government on this issue. We are in fact engaging the department. We are waiting for a meeting with the Minister within the next week or so to actually chat about the rollout projects and how our doctors can play a role in those projects, and to actually just find out a bit more, because detail sometimes is lacking in this area. But an area that concerns us, and Dr. Ramatuba is going to speak more to you about this shortly, in NHI, of course, is the doctor shortage issue, because we believe there are two critical areas of NHI's success, and the one is the staffing, and clearly we speak for doctors, so the shortage of doctors for us is an issue. The other aspect is funding, but we're not going to talk about that today. If you look at the number of registered doctors in South Africa, we have about, at best estimate, probably about 26,000 registered practitioners in the country, although this is always difficult to confirm because of the highly migrant nature of doctors. So you may maintain your registration in South Africa, but actually be working outside the country currently. I just need to remind you that at last count in Australia, New Zealand, Canada, and the US, 23,400 South African doctors work in those 4 countries collectively. Those are South African trained doctors who in fact left the country. So we almost have the same amount of people working outside the country that in fact are working in the country. If you look at the success of any healthcare system, the ideal doctor to public ratio, if you look at doctor to 1,000 person ratio in the country, is around about 1. If you look at a country like Brazil, which I think compares well to South Africa, the ratio is about 1.85 to 1,000. South Africa is sitting at 0.77. So we really are quite far off the mark, and this is an area of deep concern to us. So the shortage of doctors for us is a very serious issue, and I'm going to in fact leave Dr. Ramatuba to speak more to that issue in a short while. Just on the issue of shortage, I may just want to touch on it, I'll ask her to comment on it as well, is I think the Cuban training program that government has embarked on well over a decade ago is very commendable, and it has achieved some ends. But I think in 2012, as SAMA, we've got to ask, what is the role of the Cuban training program in South Africa still? Should we actually be taking those resources we are spending and perhaps applying them back into our own system and getting those people trained in our own healthcare system? Lastly, I want to just touch on the issue of cost drivers in private healthcare, and I certainly would ask Dr. Mukota, who's now joined us, thank you, to perhaps speak to this in a short while. But the one issue we want to be very clear on is that we are all too aware of the fact that we are often the whipping boys or girls of the so-called rampant healthcare inflation that is out there in the private healthcare sector. And truly, when one again looks at the facts and the data and one analyzes this, that is not the conclusion one can draw. If you look at, for example, the private healthcare funding industry, I think there's a lot to be answered for in that area. Medical schemes, by their nature and from a statutory perspective, are non-profit organizations. Okay? So they may not actually turn a profit. But we all know there are many aspects to managing healthcare, administering healthcare through subsidiary companies, management companies, that in fact are for-profit companies. And when one looks at those companies, they're turning a very healthy profit in this country. So I think one needs to be a little bit more cat-footed when one analyzes the so-called not-for-profit issue around private healthcare funding. When one looks at the data I was referring to, and it's going to be in your media pack, you'll see there's a graph. And this is a rough breakdown of the data from the Council on Medical Schemes, which is the statutory body that controls the private healthcare funding industry in South Africa. And if you look at the data from about 1997 through to 2010, one can note some interesting information. The first is that if you look at the amount of money that in fact is being paid out on so-called administration, it amounts to about, certainly in 2010, to about 13% of all expenditure in private healthcare. When you look at the hard, raw rand amount, that's just under 12 billion rand. 12 billion rand was spent administering your healthcare, those of you who are sitting on your medical aid cards as I speak. If you look at the amount of money, to the contrary, the amount of money paid out to medical specialists in 2010, it amounts to about 19.5% of all expenditure. And that equates to just under 19 billion rand. So almost 2/3 of the amount of money paid out to specialists was in fact spent on administering healthcare. When you go to GPs, your general practitioners, who are the cornerstone of any healthcare delivery system, the situation is appalling. You see that GP's payout in total was 5.5%, and that's been in real terms declining over very many years. So when you look at the hard raw amount of money paid out to GPs, it amounts to just under 5 billion rand. This is less than 50% of the amount of money that was spent on administering healthcare. So I think the facts kind of speak for themselves, and our position is quite clear that we do not believe doctors are responsible for the so-called rampant healthcare inflation. I think when you look at it, there are many other players in the system. It is a monolithic bureaucracy. And doctors really are just bit players. And from our perspective, It's an increasingly regulated area, and the ability of a doctor to deliver what he has trained for, what she has actually trained for and wants to do, to actually just look after patients to the best of their ability, is becoming increasingly difficult in the private sector. Thank you very much. That's all I want to add.